Thank you so much, Marina, and it's a pleasure to be here. Thank you for the opportunity. So I would like to welcome everyone as well. Thank you for joining. And, we're talking today about post-COVID challenges, which may seem a little bit premature, but we do seem to be going into a new phase. And I hope that you will find some good ideas in what we talk about that you can take advantage of as we move towards the future. As Marina mentioned, my name is Rencia Mellis. I'm the founder of Integral Workplace Health, where we support organizations to grow the psychological health and safety of their workplace, as well as support them to help their individual employees foster mental health. So our agenda today is pretty simple and straightforward. We're going to be talking about COVID-19, and we're going to be talking about COVID-19, how it's affected mental health, and how it's being framed and why it's being compared to going through a traumatic experience. And then we're going to talk about what organizations can do for their employees and volunteers to support them with the impact that these events have had on their mental health. So this is being framed, the whole experience of COVID-19 has been framed as the biggest psychological experiment in history. And that is due to the fact that it has such huge geographical reach. It is because there are ongoing uncertainties that people are coping with, and because of how broad the impact has been in people's lives. And it's considered a trauma, and this is not my brilliant insight. There's a lot of research going on in the field of psychology, and at Columbia, George Bonanno, who is a renowned resilience researcher, has talked about the COVID-19 pandemic as a traumatic experience. John Hopkins, University of Washington, they're all doing research and framing this as a trauma. And a trauma is an experience that is often unexpected and that we're not prepared for. It's something that brings to us extreme stressors, so way more than what we have in our normal day-to-day lives. Of course, we have busy lives, we have workload, we go through life changes, and these stressors that come from a traumatic event are on top of and way beyond. So they call on our coping skills to an extreme extent. They're disruptive to our functioning, as well as disruptive to our day-to-day experiences. And the other thing that is typifying of going through a traumatic experience is that it can challenge everything that we know, the way that we think the world works, what our beliefs are, our values are, how we see ourselves or how we see the world around us, maybe thoroughly shaken up. It's like the rug is pulled out from under us. Suddenly all the chess players and all the spots on the chessboard are in a different place. And so people are trying to come to terms with that disruption as well. And those are very typical aspects of a traumatic experience. And that can happen on an individual level, and it can happen on a global collective level. The thing is, though, that of course the impact and how it impacts people, where the aspect is that is most traumatizing for people, that is going to be different from person to person. And so people have different ways of responding to a traumatic experience. However, when we go through a traumatic experience, there are different phases that have been identified over and over again in research that we go through. And I'm going to just talk you through some of these because you will probably recognize these things as well. So, there's the pre-disaster phase. Now, in the pre-disaster phase, we heard some rumblings. People were hearing about this illness. Maybe it was in a different country. We didn't really know. Were they going to call it a pandemic? Were they not going to call it a pandemic? And then, it's there. It is now at our front door, and we're dealing with lockdown. So now that trauma has started, or it's been initiated, this phase and this experience, we're right in the middle of it. And the first response that people have is actually optimistic. It's called, the heroic phase. We're going to get through this. We can do this. We're confident. We're comfortable. This will pass, and we're going to get through this. And, if you look at social media at the beginning of the pandemic, you could see that, people are posting recipes for baking. People got into all kinds of other things. They're displaying their talents. Suddenly everybody is, singing Bohemian Rhapsody. I have no idea why that song was so prominent, but that seemed like a very prominent song. Lots of people singing Bohemian Rhapsody, displaying their talents on YouTube and on Facebook. Lots of funny memes happening because, this is okay. We're going to get through this, and we're optimistic about the outcome. The next thing that starts to happen is we kind of go and we start looking around us. Now we're in this together, and we really start to turn to our community cohesion. And we saw that happen too. And we saw that happen also on social media. Suddenly people are dancing in the streets at distance with neighbors that they usually have very little to do with. There's all kinds of acts of kindness. Oh, how's my neighbor doing? My elderly neighbor, are they able to go and get their groceries? Do they need some help and support in this situation? So we start doing those kind of things. We reach out to people that we haven't talked to for a while, or maybe people on other sides of the globe, and say, how are you doing? What's happening with you? Are you safe? I hope you're well. So this is the next piece that we go through, where we look for our community and we start to look out. And again, this is still while we're doing pretty good with what's going on. Eventually, as time goes by, people get disillusioned. They get physically and mentally exhausted from being out of shape, by having to do things differently, by having to learn how to do things differently, having to unlearn things that worked well for them that they can't do now. There's disillusionment, there is fatigue. And we saw that happen as well, where there was a phase where there seemed to be also, for instance, increased risk-taking behavior, where, we would get in a car with somebody that really, even though we weren't allowed to be in the car with somebody else, we're like, oh, who cares? I'm just going to get in with that person, or I'm going to go see my family member because I need it. I must be able to see that person or to spend some time with them. And so there was some increased risk-taking behavior. People are just tired of it. Suddenly they realize, yeah, you know what? It's great to be singing Bohemian Rhapsody and temporarily be working at my kitchen table. Now they're starting to look around and going, oh, this is not sustainable. I can't do this long term. And so this is where people hit rock bottom. Now, there's always people that get stuck there, that get stuck at the rock bottom piece, that have a really hard time. And I always compare it a bit to, there's people that are, you're waiting for the bus, and you're waiting for the bus, and you're waiting for the bus. And while you're waiting for the bus, you could have walked home 3 times over, but you've already invested so much time in waiting for the bus that you're not going to move. And so some people kind of get caught there, and that's very difficult, because so they continue to be, disillusioned, fatigued, unable to make the changes. The majority of people will start thinking about how to rebuild and what they can do. So they start to take control. They start to incorporate these changes, and they start to manage them. They start to deal with the stressors, and they start to put strategies in place to help them minimize the distress that they're experiencing. Now, the one thing that makes the whole COVID trauma experience very unique is the fact that in the rebuilding phase, we don't really know how to rebuild. We don't really know when we can start. We have this webinar going on for post-COVID. Are we really there? Are we post-COVID? Maybe we're not. Maybe we're just taking a break temporarily. So this is one of the things that is very unnerving, that also has an impact on people's mental health. If my house is flooded, I know how to build a house. It might take me time to rebuild that house, and I might need to, put the house on stilts. So I might make some changes to make that house better functioning if there's going to be another flood in the future. But at least I know what I'm doing. I'm going to get the green light when it's safe to start rebuilding. With this pandemic, that's not happening. That is still unclear how and when we can rebuild. And so that also is having an impact on people's mental health and their ability to start moving on. It's an extra challenge to keep moving. So what happens the impact of a trauma and why and how people are affected, there's a lot of different things. So if you're dealing with 100 people, if you're looking at your employees or your volunteers, they may be affected quite differently from person to person. And that's important to understand, that everybody has their own way of responding, their own way of expressing the distress, but also there's different things that may or may not have been protective for them in how they are dealing with the stressors or how they are distressed. Part of it is the severity of exposure. And so when you're in the nonprofit sector and essential workers, clearly they are much more exposed to the impact of COVID and have a much higher risk for themselves. So you can expect them to be more impacted by what it is that they are confronted with, particularly people in the nonprofit sector that are working with the human services parts of nonprofit work. There's individual factors, people's, existing optimism, their health, their social support and social cohesion that they have, family context. If you're in a family and you're suddenly all put together in a home where you can't leave and you're under lockdown, the cohesion within that family, how things are dealt with in the family, how adaptable that family is. If you have a very rigid family and you're trying to do what you always do under different circumstances, that can be very challenging, and that can add to the impact of the traumatic event. And obviously, community characteristics, and that's really talking about the social context in which I'm working. Perhaps things like how safe is the environment that I am, the expectations of social justice. And again, because many people in the nonprofit sector are working with disadvantaged groups, with marginalized groups, their perspective may be also affected there as well, because that's going to be magnified and put under a lens. Those social inequalities may be characterized and may impact the severity of the trauma that they're experiencing. And whenever I talk about this, about how people are impacted and, why and how severe, and that everybody's different, the thing here is so important to understand. There's no shame, there's no blame, and no judgment. It just is. People are impacted. You may be impacted, and it has nothing to say, or it doesn't relate at all to the extent that you were committed to your cause, that you were committed to others and to yourself. It has nothing to do with that. Life happens. And so there's no shame, no blame, and no judgment for yourself or for others that might be impacted differently or more severely than you are. And that is a really important thing to keep in mind as we're going along. So there's some common factors. Now, this really, what I should have put there is common symptoms include, this is not an all-inclusive list, but these are common things that people experience during a traumatic event. People may develop depressive symptoms, and that means really that they have a loss of optimism. They may have a sense of hopelessness and get hung up on negative and worst case scenarios. They may not see a way out, that this is going to get better, that they can do something to make a change with that. And so, those people that are kind of at that bottom of that curve that we talked about, that get stuck, they may get stuck with some depressive symptoms of loss of optimism about their own ability to make a change, as well as the changes that might happen in their community and in the world around them. People might experience severe anxiety, and that can express itself in a lot of different ways. What you might see is people that are withdrawing, because they don't want to touch things, they don't want to be around people. Maybe they're very hyper alert and hyper aroused. So somebody may have anxiety and still venture out, but what it is, they become very nitpicky about following all the protocols. They withdraw when somebody doesn't wipe something down. So these are some of the things. They may be hyper alert and hyper aroused to triggers that identify risk for them. Perceived risk or real risk doesn't really matter at that point in time. It's triggering their anxiety. Some people get into obsessive thinking, and one of the things that really feeds into that of course, is social media, because social media is something that we choose to engage with, but it's also something that kind of comes to us. You know, the minute you answer your phone, you have notifications and you have your feeds. If you're setting your alarm at the end of the day to get up the next morning, you know, there's all your notifications and there's your news feed happening. And so those are some of the things that can also contribute to obsessive thinking, where people just go over the same scenario over and over, and they can't seem to break that mold where they just keep repetitive thinking and thoughts and concerns and worries taking over their ability to think or problem solve physically. And different people will manifest this differently, whether they go to cognitive disabilities or emotional impact or physical impact. Some people display physically more than the other areas. None of this is mutually exclusive, by the way, whether you have, you know, physical symptoms or cognitive or emotional impact. These can go together and may have different proportions in how they affect you. You know, physically, people might stop eating, might start eating. People might have problems sleeping because they're worrying, they can't get to sleep. Some people can't stay awake because they're escape sleepers. Their patterns are affected. And again, with that, they're more vulnerable, because that also obviously infects, you know, our general ability to function and to stand in the world if we're fatigued or if we're not properly fueled with good nutrition. People may have moods. And the thing there is that people might have different moods. They may be really irritable, they might be frustrated, they might be angry. And again, because people are surviving, they might be just strung so tight that anything that nicks them reverberates all up and down the line. So they can't handle any new stimulation. People might cut off conversations. They might cut off exposure to certain situations because they just can't take anything else out, because it's going to reverberate through their whole system. Some people have severe emotions, and, you know, usually they can kind of keep it under wraps. Other times they might have difficulty regulating their emotions, where they just, you know, where they're snappy or angry, or they're expressing sadness or emotion, they're crying. This may be some of the things that, again, you might see with the people you're working with, and that for managers will need to have to address going forward with your employees or your volunteers. And people might have intrusive thoughts where they can't get back. And that's kind of similar to the obsessive thinking, but where they're functioning and then they just keep coming back to one thought that dominates everything. So those are some of the symptoms, and those are going to come out in the behaviors of the people around us, or our own behaviors, because nobody is impervious to this. Now, here's the thing. People have been infected. They will be affected. Research on resilience shows that about 70 to 75% of people, they will be symptomatic, but they will symptomatic on threshold. They will be sub-threshold. And what that basically means is, yes, they're affected, they are challenged, they may be withdrawing, they may be agitated, they may be worrying, but it's at a level that is sub-threshold for actually diagnosing it, for instance, as PTSD or as actual depression or anxiety disorder. So they may be experiencing all of these different symptoms, but they're in a way that they can manage, that they can overcome, and that eventually these symptoms will actually lessen and be reduced and go away. So most people actually do that. That doesn't mean that they don't need support and help with these symptoms. The other thing is, some people actually develop quite severe symptoms. And these are people that will come to long-term impaired functioning. And there's all kinds of reasons why that can happen. You don't know, you know, what somebody is carrying with them from before the fact that they found themselves in a COVID-19 situation. Maybe during the COVID or the pandemic, maybe they were ill, maybe they were intubated, maybe they lost somebody, or they had to be with somebody as they were losing them, and that was intubated, and they had to worry about a loved one. So there's all kinds of reasons why people might have very severe symptoms. And again, there's no shame, no blame, there's no judgment about people that have been severely impacted. Some people will have a delayed response. And this is one of the things, again, with COVID-19 that makes it quite unique, is that a lot of people, because a lot of our coping, because a lot of our rituals like funerals and dealing with grief, medical procedures, they've all been kind of put on hold. And so what a lot of people, what they're expecting is that as things ease up, there's going to be a wave of delayed grief, because people have powered through, they get through the situation. And then when the pressure is off, they look back, and this is when they're suddenly confronted. You know, we've experienced this maybe in a small scale ourselves, where, you know, we've been busy all day. We just do what we got to do, and we keep on going. And then just as we're about to turn the light off and our brain is kind of winding down, all those things that have kept a lid on what we were worrying about or what was concerning us come out. And then right before we're about to fall asleep, we start to worry about those things that we've kept under wraps throughout the day by being busy and just getting through the day. And then, of course, there's always a small percentage of people that have no response, that just keep on going, and that are fine throughout the whole situation. So this is kind of like what you can expect and what you may see with your employees and with your volunteers, that they may have different responses. And of course, as we're moving forward, you know, it'll be also important to understand the delayed response and being prepared that, you know, this may actually happen, and don't go, well, it's done. Why are you still hung up on that? To understand that that is also a natural piece of the response. Now, COVID-19 is a unique stressor because of that whole, you know, trauma curve, that fact that we don't actually know, you know, how and when to start rebuilding. There's some other aspects of COVID-19 and the pandemic and the measures that make it really unique. First of all, it affects all the aspects of our life simultaneously. And usually, you know, when we have a challenging situation, when we go through change, we need to adapt, we need to revisit, you know, what we believe and how the world is happening, or how we do things, and we need to learn new skills. It's one part of our life. You know, maybe we go and live somewhere else, maybe we go to a different job, we become parents, you know, we lose somebody, we have a relationship change, we go into a new phase of family life or a family life cycle. Those are individual aspects of our life. What is really unique about COVID-19 is it has affected our social life, it has affected our personal life, it has affected our work life, it has affected our opportunities for growth and learning. So every aspect of life has been disrupted. So that's one thing that's very unique about that. And not only that, because of the measures that have been taken, we have been blocked access to a lot of our normal coping strategies. You know, if you're somebody that does retail therapy, well, good luck with that. You need to go online, but you are not browsing or wandering around the local Winners to find something nice, or wherever it is that you go. You know, you are, if you're somebody that likes to socialize, you know, to cope with stress and let go, to just go and hang out with a friend and, you know, shoot the breeze over a glass of wine or over a coffee, it's not happening. You need to do that differently. If you go to the gym, gyms are closed down. You're not going to the gym. You know, I'm based in Ontario, so gyms, the lockdown in Toronto and the surrounding area, the lockdown on gyms has been really long-term. You know, self-care strategies, manicures, hairdressing, all of those things, grooming strategies, and some of our rituals that we have. You know, we have different rituals in our life. And I was just talking to Marina about that earlier, you know, the rituals that we have that anchor us. You know, every Friday evening we go and do this particular thing. We meet with a particular friend, or we head out and go and have a beer with a friend, or we do something. We have a special dinner. Those rituals were also disrupted. And so if you look also, you know, at the definition of mental health, and I'm not talking about mental health as mental illness, I'm talking about mental health, because you can have mental health and mental illness. They're not mutually exclusive. You can have a sense of well-being. You can feel that you're productive, that you can participate and take on and cope with normal strategies. You can feel that you are participating in your community without being without this, how do I say, you can have mental health and mental illness. You can have mental illness and still have all those aspects in your life. And you can have poor aspects in that. You can struggle with your well-being, with your coping strategies, without having mental illness. And this is one of the things that we need to understand, that every aspect of our mental health has been affected by COVID-19. It's much harder to find our sources of well-being. Our normal coping strategies for have been blocked. Our stressors have escalated. It's much harder to be competent and confident because we need to do all these kind of things differently. Perhaps we're even blocked from participating in those things that we usually do because we've been furloughed. So we're not able to find those things that give us a sense of participation, of fruitfulness and productivity. And of course, you know, being able to connect with our community, to contribute to that community, and implicitly have a community that is going to also have our back and give us solace as we go along. All of these things have been impacted by COVID-19. And for nonprofit volunteers and employees, there's some very unique characteristics in the sector that play a role. You know, and to some extent, this sector has come in, you know, with a pre-existing disadvantage because of the way that the sector is funded. It's often, you know, project-based. It needs to be renewed all the time. And there is a real clear, there's restrictions on how you spend the money. It has to go to the project. And there's very little money available to actually build capacity and capability within the organization for long-term resilience, and very tight budgets. And that means also limited availability to really bring in mental health supports for people that are doing really important work. So this is where there is some disadvantage. So they may not have been digitized. There may not have been existing resources for people care for the employees and the volunteers. The other thing that's quite unique is the profile of the actual employees. Employees that choose to work in the nonprofit sector are people that are highly dedicated to what they do. You know, if I'm working, I may enjoy and be engaged with my employer and be total believer in the laundry detergent that they put out on the market. That's a whole different thing than seeing yourself, your self-image, your self-identity, and your values tied up with the work that you've chosen to do. Because a lot of people in the nonprofit sector, there's a higher levels of self-sacrifice, and what they do and how they engage is very tied up with their personal values and philosophy and their identity in what it is that they do and their beliefs. They work in, many people in the nonprofit are working in human services, so they're at a higher risk of vicarious trauma because you're inherently working with groups that are disadvantaged, possibly marginalized. So you're reaching out to these groups and you're seeing what's happening with the people, your clients, who may be disproportionately affected. Because one of the things that we know about COVID is that if anything, it has really put a lens on the social inequities of access to healthcare, access to support, access to mental health care, and you know, the concerns and the fears that some might live with some of our clients around being able to take access, to get access to safety measures to help reduce the risk, perhaps even just having the trust or lack of trust to engage with the institutions that are supposed to be helping us stay safe. So these are some of the things that put human service nonprofit volunteers at a higher risk. And this is something that also, you know, essential workers are experiencing. They're really in the thick of it. They're seeing the impact on their clients and how that's playing itself out. And because of the lack of access for the clients, they may themselves find themselves at a higher risk for getting COVID. So they are coping with that anxiety, not just for themselves, but also for the people around them. You know, they are maybe, because of that, they need to self-isolate. They may not be able to engage with their supports and their elders, with their families because of that. And they do emotional labor. I always talk about this. Emotional labor, my example for emotional labor is, you know, the bank teller or the Walmart greeter that could be having their most rotten day. Maybe they just had a big fight with their partner, they have a headache, their feet are killing them, and yet there they stand, smiling and making you feel welcome and offering you the service that you need. And so that happens with people in the human services sector. Anyone that's working with the general public or with clients outward facing, they need to keep a part of themselves hidden. They cannot address that part. They need to suspend that while they focus on the needs and the service to others. And that means that they have an extra level of need for support and resilience and self-care to be able to refuel and recharge, to be able to continue to do that work, not just today, but tomorrow and the day after. The other thing that's unique in nonprofit is people often find connection because we're all in there. We all have a shared purpose and objective. And so we have a strong community around us with the people that are doing the same work and that we work with. And that also has been disrupted, that ability to connect and to connect with the purpose and to connect with that community of shared purpose. So what to expect? So those are some of the things that have been acutely happening throughout COVID, and how your employees and volunteers may have been impacted throughout the last 18 months, really, with coping and trying to continue to support and deal and adapt and go to different platforms and different ways of working and continuing to see what's going on with their clients. So as we're going into new phases and as we're going to some changes, here are some of the things that you might find. You may find that these delayed symptoms start to come out. I already mentioned that, you know, they're predicting, psychologists are predicting that there will be a wave of grief that is going to be unleashed once the pressure is off and things kind of start to look like normal again. There's going to be lingering anxieties. Just because we're doing things perhaps the way that we used to, that doesn't mean that those triggers are gone and everybody's going to go, okay, well, I'm going to rip my mask off. I'm going to sit around with people. I'm going to touch that elevator button. I'm going to get in the elevator with people. Those things can linger because we've been trained. We've been looking and hyper alert to these things. So those are going to stay for a while. And what you're going to need there is a lot of compassion and understanding that this is lingering. You're going to need to have compassion with each other, for yourself to realize, hey, you know what? I'm still not comfortable getting in that elevator with two other people. I'll catch the next elevator. Allowing yourself that, being compassionate with yourself and compassionate with other people that could just look like they're like, you know, just not moving forward and getting stuck in there, or just being really where you feel that they're holding back moving forward and progress. So that's one of the things that we need to do. There may be triggers, there may be hyper arousal, something new happens and people revert to before. One of the things that there's been a lot of talk about, and I don't know if you've seen this, but there's been some articles about what they call the cave syndrome. And this is, you know, people that have been in severe isolation and that have really kind of gone into their bubble. Some people will actually need help to come out and start to socialize again, to start to connect with other people again. Other people will come out, but they're going to just feel kind of awkward because those things that we do, you know, where we just kind of chat with people and make small talk, and maybe we're not talking about COVID the whole time. It can feel awkward to be going out and just having those day-to-day little, you know, chit-chat conversations. And how do we socialize with people again? Those are some of the things that might be coming forward, that we need to find our balance again. You know, and this is also comes into the fact that before and after people are changed. You know, people may have changed their priorities. They may have had learnings and lessons, some for the better, some for not. May have experiences that they've learned that they really like. You know, when I talked to a lot of people in the beginning, a lot of people were talking about, you know, the stressors. They were really fixated on how they were being impacted, the symptoms that they were experiencing. And as time went by, more and more people started talking about, you know, how they started to make changes. And this is that resilience piece where people, you know, maybe the situation isn't completely resolved, but they start to take control. So they start to manage the stressors and they start to find ways to reduce the distress that they're experiencing. So they go out for walks, they start yoga, breathing, new hobbies, They're realizing they're taking advantage of the fact that they're not in traffic. They're taking advantage of the fact that they're not socializing with 100 people. They just select who they're going to socialize with. They're withdrawing from some social media. So people are making changes, and some of those things they're going to want to hang on to. It's like going to live in a different culture for a year and then coming back and wanting to hang on to, some of the foods or some of the ways that people manage life in that culture. And so people are changed, and there's going to be things that they bring with them. What's also changed is perhaps relationships. And this is, again, this is going to be somewhat linked to the delayed symptoms that people might have. What's going to be different also is how I relate to people, not just that cave syndrome piece, but as we've been going through the last 18 months, there are people that we had eye-opening experiences with, some of them for the better, somebody who turned out to be really supportive or really creative, or we saw a different side of them. And then there were people where we were just really disappointed. We thought we could count on them, and they weren't there for us. Perhaps, also because one of the things, of course, with COVID-19 and the measures, it's also become a highly politicized conversation. Perhaps we realize that people had, maybe we both have the same purpose and belief in the work that we're doing, but somehow that person is not who we thought they were. They're displaying traits or beliefs that we're like, I can't find myself in that. I can't relate to that. And I don't think I want to be your friend anymore. So all of these things have changed. We need to be renegotiating those relationships, how we're engaged with different people. So relationships have been changed. And of course, there's ongoing uncertainty that is going to play itself out with people. And so we need to find flexible strategies to respond and support people. So here's what you can do. The first thing is, realize that people know a lot about what they need and where they want to go. So one of the things that you can do is you can really start to listen. And I wish, when I was writing this, I wrote this big piece on top that says there's no one size fit for all. And I wish I could just give you A, B, C, and D, and it's done. I can give you guiding principles, and you're going to find that a lot of those guiding principles are things that we could have known and should have known even before COVID, that we should have been working with. But if anything, COVID has been a pivoting point to really bring the attention to the impact of mental health and the need to do those things in the workplace with people and for people that will help create a healthy and safe workplace and foster that mental health that you need, not just for today, but for tomorrow and the day after. So one of the things that you want to do is listen to people. Ask them what's going well, what is going well, what's going not so well. What would you suggest we do different? And you can do that. People have been doing surveys. They're incorporating it in one-on-one discussions, asking people what are things that are working and what's not working. Then of course you need to acknowledge it. If you're going to ask that question, you need to also be able to think about how can we accommodate that? What does that mean about the direction and the way that we're doing things within the organization for our work process, for how we engage with people? So you need to acknowledge it, and then you need to, where you can, accommodate and make changes. You need to let people know that you actually listen to what they're saying and that you heard it. And again, like I said, a lot of people are doing surveys, and not one survey. They're doing perhaps monthly or bi-monthly surveys just to stay on top of the employee experience around what's going well, because there is no best practice at this point in time. We're just all kind of figuring it out as we're going along. So listen to your people. And you know what? If somebody tells you, if you get a clear message from people that you made a mistake, that you did something that was not working for them, whether it was a practical decision or a emotional support kind of decision, own it. Don't, one of the big keys of effective leadership is being transparent and honesty and saying to people, okay, we heard you. This did not go well. We could have done that better. Let's go to the next phase. We're going to talk about how can we do this better, and just own it. You don't have to do a big mea culpa, but you can just acknowledge this is what we're hearing, and we're going to do something with that. Then there's all kinds of things that you can do in fostering self-care, because whenever it comes to resilience, it always still comes down to two things: helping people develop regular habits that help refuel them, that help them put gas in the tank. Some things like healthy eating, taking breaks, connecting with the things that are important. All of these kind of things that are part of self-care, physical self-care, helping people find good ways to take breaks, to do breathing, to manage the workload, put in boundaries. All of these things are part of self-care. And so you can foster those things. You can show people what the things are, and ways that you can engage people, actively engage things. Some employers have actually put out competitions and challenges, or you can include it in your conversations when you have your one-on-one check-in conversations with people. Say, how are you taking care for yourself? What are the things that are blocking that? How can I help? How can I encourage you to take better breaks, to make sure that you take those 5 minutes, or that you go for a walk when you have a break, that you make sure you have time to be home with the family when you need to be. These are the kind of things that you need to be fostering with people. Fostering community, that connection with community, you can do that with team meetings. You can do that with events. Where you bring people together, because what you had before may not be happening, where you all got together. Maybe you had rituals around potlucks or gatherings where everybody comes into the office at a certain point in time. That may not be happening. So how do you foster community, or whether it has to be digital or face-to-face? There's different ways of doing that. And it can be as simple as inviting everybody to tune into a performance online at the same time, and then have a pre and a post chat with people where everybody brings their own wine, brings their own snacks, and you talk about that. You don't talk about COVID. You talk about perhaps that performance that you watch. It's a storytelling performance, which is my own personal bias. Or you have watched a performance, a movie online together that you then talk about. And that goes also to the distraction strategies they find over and over. People that are able to look in a different direction. And that's not to say that the rotten things aren't there and the difficult things aren't there, but to broaden your horizon, to look at different things. So distraction strategies can be anything from, having somebody display their talent, have a competition around, what did you do? What did you learn? Did you learn a new language? What did you do? Did you start baking? Show me your breads. Things like that, to look at other things and not just at the problems that we're faced with. Those problems are there. You don't need to stare yourself blind on them. They're going to be there whether you're looking at them or not. So you are allowed to look in a different direction. Communicate, communicate, communicate. Sometimes that's about providing access to understanding about how you're making decisions, what your considerations are, what your challenges are, what you've learned from your conversations with people. And sometimes it's also giving people good information so that they can assess in their circumstances and the work that they're doing on your behalf. They can assess what they need to do to stay safe. So that's another thing. People that have good information, incredible information, are able to make better solutions and feel safer going into different situations. And of course, if possible, you can provide people mental health resources. And again, that doesn't have to be, an EAP. If you're a big organization, perhaps you can invest in bringing in an employee assistance program. But there's other things you can do. You can workshops, you can do newsletters, you can do links to articles. There's all kinds of other things that you can do in giving people access and to information, and perhaps letting them know where they can find free resources. The other thing is fostering awareness and compassion. Again, this is your newspapers, your campaigns that you might be having. And I cannot emphasize enough the importance of management in this. Management are your ambassadors. So whatever you decide at the top, your managers are the people that are needing to demonstrate that are your ambassadors and your spokespeople, but also the people that have finger on the pulse with what's going on with people. So you really need to empower your management and support them. So your manager needs to be a role model for for self-care behavior and resilience. And that means that your manager needs to take that 5-minute break. They need to put those boundaries in. They need to actually live the things that you want your employees to do, to be able to get that message out there that says, hey, we want you to be healthy today, tomorrow, in the long run. And these are the things that we encourage you to do. Take a vacation, go away for a period, take your break, get your exercise, make sure that you have time to spend time with your family. All of those different things, the manager is the key there, because people will do as the manager does, not what the manager says they want them to do. So that's one of the things you need to do. The other thing where management plays an important role, because, and particularly in the nonprofit sector, because people do tend towards much more self-sacrifice. They are so committed to their purpose and their goal that they will hold it. They're at a higher risk of holding it against themselves, when they feel that they're struggling, when they try and take time for themselves, when they step out and turn away perhaps a request from a client, when they actually put in those boundaries that they need to be there in the long run. So the management plays an important role in getting that message out there and saying, you're allowed to do these things. We expect these things from you. It doesn't mean that you're not committed to taking care of your clients. It doesn't mean that you're not compassionate. It means that you're taking care of yourself so that you can be there in the long run. And so they may explicitly need that permission and that message. When there are requests, because there are going to be lingering triggers and anxieties going on for people, the BYAF request is, but you are free to say no. And the paradox there, of course, is there's a big difference about being told that you need to go and do something or giving the option to do it. Weirdly, people that have this sense of control, that they can weigh the pros and cons and the risks themselves and make their own decision, are actually more inclined to do these things because they've owned it, rather than feeling that they've been pushed into an unsafe or an anxiety-provoking situation. So introduce that concept of working with but you are free requests. And then, of course, have a plan for if somebody actually says no, because they are taking up that freedom. You need to really mean that. It can't be, like with a quiet coercion on the other end. Yeah, you're free not to do it, but if you don't, we're going to, advertise that, or I'm going to hold it against you, or whatever. People really need to understand that they are free to say no. And then when they say no, to accommodate and to be able to manage that. And of course, mental health awareness for managers, incredibly important to see, where are my troubled staff and my troubled employees, and then giving them the skills to respond to those people and to engage in that conversation to find out what's going on with you. How can I help? That compassion of understanding where people are and then being able to say, how can I help? And again, that's great if you can get a third-party training in, if you can do that in a workshop with people. Other things that you can do is, CMHA has lots of things. Perhaps what you do if you are a small group but you want to foster that mental health awareness, maybe you ask your managers to read an article about mental health, and then start your next team meeting with the managers by having a discussion about their experience and their thoughts and observations, or having mentors and consultants. Perhaps you have other people on staff who have the experience, that have those skills, and that can coach people and that can mentor people that need to go into a difficult conversation when they are worried for the well-being of one of their staff. So there's all kinds of ways that you can do that in an affordable way. As an organization, there was a great piece of research that came out of McMaster. One of the things that they found is that undoubtedly nonprofits have been affected. Their abilities for fundraising have been affected. So they needed to, some of them went to new operational models for doing that, for fundraising. They had to go online. But what also happened with a lot of funding is that the funders kind of shifted as well. And, you know, I'm part of a nonprofit arts organization, and we went through that ourselves, that suddenly there were some funds freed up without all the restrictions about how you spend it. And that means that there was some opportunity to build capability and capacity with some of the funds as they came in. And that was one of the findings that this McMaster research found, that because funders are realizing that they had to adapt some of the restrictions and that they had put on how the money is spent, and giving people more free rein under the, you know, uncertain and changing circumstances, it also allows for some opportunity for transformation. And so as you're going forward, you know, it's an opportunity to create change of the second order. And change of the second order is when you actually change your paradigm, where you transform maybe your business practices, maybe you transform some of your operational practices, and how you organize the organization. Perhaps it means digitizing certain things and keeping some of the things that have actually worked well throughout the pandemic and incorporating those. And the difference there is, you know, you can kind of go back to what it was and then just tweak it a bit, or you can do something completely different that allows you to build towards the future and to think really long term in terms of building resilience for the organization in the long term. One of the things you need to do that if you are going into that transformational piece where you're thinking, okay, you know what, we've learned a lot about how things are done. We need to do things differently. We need to do things differently on long term in terms of how we use the different technology platforms, how we do our business model and how we get our revenue, how we spend our revenue, all of these things. Maybe there's different ways that people engage with their client group, different ways of working. If you're going through that, first of all, it's a long-term project. It's not something that's going to be flipped around on a, you know, on a dime. This is a long-term investment, but it is also something that you need to incorporate. Your culture needs to adapt to that. That the incentives and the way that you work with people is going to adapt there as well with your culture. And what's happened with a lot of organizations throughout the pandemic is that they've lost sight of the culture because everything was kind of spread out. But culture happens no matter what. Culture is all those unwritten rules and norms and behaviors and decisions and values that you have. It's not your purpose. It's not your mandate. It's not your mission statement and your vision. It is what happens on a day-to-day experiential level in terms of the things that are tolerated, that are rewarded and not rewarded, and how they're distributed throughout. And so you need to kind of look at your de facto culture that has been happening throughout the pandemic without, while you weren't paying attention necessarily to that, and incorporate that piece also going forward. So those are some of the things that you do. So it's about, you know, your organizational focus, and it is about a lot of different things that you can do in how you relate, and really on a small scale and on an organizational level can support people to cope with COVID-19 and how it's affected your organization and individuals. So clearly, you know, there's no doubt that COVID-19 has had phenomenal impact on organizations and on individuals. And just because people have found ways to minimize the distress, that people are actually proving resilient, that doesn't mean that they don't benefit from ongoing compassion and support as we go through these times and they continue to change going forward. And yes, COVID-19 as a crisis is going to pass. We don't quite know what it's going to be like. And so that need to continue to be compassionate and supportive for yourself and for your volunteers and volunteers and employees continues to be there and will benefit your organization in the long run. Remember that everything is in flux, and it's not about reestablishing previous practices, because we're in when we're in a period of flux, the best you can hope for are emergent practices where you evaluate and reevaluate and continue to adapt as the situation unfolds itself, and we learn more about our people, we learn more about our client groups, we learn more around, kind of the ecosystem around us that we're functioning in under the changed circumstances. So we'll need to continually adapt those practices. Don't get yourself stuck on one thing or trying to recreate what was before, because that will not be helpful and not help you going into the future. And if you can at all, have the opportunity with your funding to start to invest and to consider how you can use some of that to really invest in your capability, in your capacity building within the organization in the long run. And this is certainly a pivotal moment for nonprofits in being able to take advantage of their learnings and some of the changed circumstances and relationships with their funders. So with that, I am going to close off. Thank you so much. I hope you got some ideas, small things, big things, insights, and understandings about what's going on with your people, and maybe some ideas that you're inspired to want to apply for people. And I'm going to just open it up if people have any questions. So Marina, have questions been coming in, and is there anything you'd like to share?
Yes, we do have questions coming in, and because we are approaching the top of the hour, I just want to let folks who need to jump off know that we are recording the Q&A. So you can go if you have other meetings or other commitments to jump off to. Off you go, and we will send you the recording of the full presentation as well as the Q&A by email later today. So Rencia, let's dive right in. You spoke a little bit about effective ways to support and engage employees. And we had one comment come in that one of our attendees, their organization had attempted to do like a wider sort of EAP training session, and they were a little surprised to not get a lot of staff participation in it, which was unexpected for them. So they were just wondering about effective ways to support and engage employees, maybe outside of something like that. And I'm wondering if you maybe want to revisit some of your suggestions, such as employee surveys and things like that.
Yeah, absolutely. And actually, weirdly, I'm actually not really surprised. What I find is that here's what I've seen doing a lot of these webinars and trainings is that people are already super overwhelmed, and they're often booked at a time when people are crunched between meetings, or it's often booked at lunchtime. It becomes, a lunch and learn kind of organized situation. So these kind of formal things sometimes do fall by the wayside because people are already so up to their eyeballs, and so it's difficult. So sometimes it becomes the smaller things that you need to be doing with existing practices. And so, the EAP trainings are very helpful, and they can be really good, but they also, people need to take the time to be there. And that can be sometimes a deterrent for people. So some of it is about the marketing, some of it is about the endorsement of that, that kind of workshop. And it has to be embedded in an overall, message of this is what we really believe, and we understand, we recognize that people are having a hard time, and we encourage you to take the time for this, and so that's one of the things that needs to happen. And then maybe what you do is, a lot of these webinars, and I've been doing actually a lot of these webinars, they are talking about, self-care, resilience practices, and all of those things. So maybe rather than telling people how they can do that for themselves, you find ways within the organization to actually foster those opportunities through things like competitions or through challenges, and saying, these are the things that we know are really good for helping people to, stay replenished and refueled as they go along. So here's what we really encourage you to do those things. We're going to do a challenge, or we're going to continue to ask you about these things. So those are some of the ways that you can perhaps embed it in day-to-day practice, rather than have it as a separate thing that people then need to make a real effort to be there. I don't know if that makes sense to people.
I think that's great insight, Rencia, because I think even sometimes their best intentions from the management or leadership side, it becomes for staff just one more thing that has to be done, right?
Yeah.
And
Yeah.
may not be reaching people at the right time or in the right way. That kind of dovetails with another question that had come in about how staff can maybe help management understand or encourage management to allow time for self-care during the day. So I think, this is also something I wanted to bring to you, Rencia, is that we are, I suspect, seeing at a lot of organizations with the culture piece that you talked about that have not been proactive about their culture, that I suspect that the culture of overwork has kind of crept into play. And, maybe we could talk a little bit about what managers can do to break that and to encourage staff to have that time during the day.
Okay, so, well, there's a couple of different things there, Marina, because what I'm hearing is it's about how to communicate up from, if you are the staff person that's overworked and you're not getting the feeling that they understand what's going on with you. That's one of the things that can be a challenge. So how do you communicate that? And that sometimes really is a very difficult thing because people have lost sight of these things, right? And it's not necessarily a malicious thing. That people have lost sight of this because everybody's just, kind of weighing it through at this point. Managers are overworked, staff are overworked. And so a lot of this is kind of dissipated, and those platforms for that exchange have been affected. So sometimes it becomes a matter of asking questions. So if you don't want to come out and say, I can't handle this, perhaps as a staff member engaging with your manager, you can say, well, what are you hearing from other people, or what kind of solutions are you suggesting for this, or have you discussed with other people, just to let them know that there is an issue that needs to be addressed. So if you don't want to come right out and say, I have a problem I want you to talk about, to say, what else is going on, or what has the company done for this, or what have you heard from other people is one of the things you engage. The other thing is, if it's a difficult thing, sometimes it's a matter, it really is, surveys are a great way. And surveys don't have to cost a lot of money. You can do those with a lot of free platforms. They don't have to be extensive. What has been your experience? What did you like? What did you not like? What's working for you? What's not worked for you? How would you suggest things to be different? And that's a way of making it safe for people to respond, right? So you can ask people to evaluate initiatives that you have done in that survey, and they can, it's an aggregate result that you get. And so that's another way of getting that message through. And if you're a manager and you're trying to get up to top leadership, using a survey, using your conversations, and kind of really tallying the data, because that's what it comes down to, is really collecting the data. That becomes another way for you to have that conversation upwards, to come in with the data about what's going on with people. Does that answer the question, Marina?
It does, and I think that's such an important point too, connecting with what you said earlier, that people often do know what they need, or they know their experience, and listening is such a key piece to that.
Yeah. And it can be a very purposeful conversation. It can be a survey, and it can just be, observing people. You can see how people are doing. Are they taking more time off? Is their productivity gone down? Are they looking like they need, they're heavily in need of some support? Have they changed?
Mm-hmm, mm-hmm. And so let's flip it a little bit, because we had a really great question come in, asking about how mid or junior staff could actually support their leadership who might be burnt out. And I know we've seen lots of surveys and data and reports indicating that our nonprofit leadership is extremely burnt out at this point in time. So I thought this was a great question about how staff can help to support leadership. And, also if you have tips for leaders and EDs who maybe don't have a community of folks, it's lonely at the top, right? Sometimes. So, if you have some comments on that.
So there's a couple of things in there. So yes, absolutely. Leadership often struggles because they do have like that emotional labor where they can't just collapse in front of people. The thing though is that what you find is that with leadership, you know, effective leaders are often people that can remain optimistic, but can also acknowledge this is really hard. Yeah, I'm having a hard time too, but I believe that we can get through this. So it's often not about being impervious, but it's about being optimistic, and communicating to people what you're doing, what the challenges are, and that you have a belief that it'll be resolved. And leaders may need to find their own community to support each other and to communicate. And there's, find different platforms to connect with people in other nonprofit situations where they can mentor each other, where they can talk about some of the challenges that they have. Because absolutely, the concept of self-sacrifice is, throughout the and the sense of a tremendous sense of personal responsibility for the organization is something that everybody has and cascades through nonprofit organizations. So that's one of the things in terms of how leadership can take care of themselves. Leadership also needs to understand is that what they do and how they present is something that trickles down to the lower groups that are struggling as well. So this is also part of their responsibility when they take care of themselves and the compassion for themselves. And I'm not saying slough off, but put in boundaries, make sure that there's self-care strategies that they're practicing, that they're, again, supporting their staff that way. And then supporting leadership upwards, certainly if you're in a smaller community. And I have to be honest, I need to think a little bit about how you get that going upwards, because it depends a lot on the corporate culture and how, egalitarian it is for somebody who is, junior or mid-level to actually address that with leadership. To say, I see that this is a really hard time, or this is a really, you're putting in a lot of commitment and work, and how are you doing? That may be a conversation that is very difficult to have. And it may be a matter of, and I have to say, I'm just thinking this through as you put the question through. It may be a matter of putting forward ideas and innovations rather than making it perhaps a personal conversation, even though it's, so-and-so at the top. You may know who exactly that is and what they're going through. You may be seeing that. It may be about opening platforms with innovative ideas that can, prompt leadership to take up some of those ideas, to make changes and to move forward. Does that make sense? And because I'm just thinking it through, and it is a very difficult conversation to have a conversation upwards.
Yeah, that does make sense, Rencia. And I think, as you say, so much depends on relationships and organizational culture and all of that.
Yeah.
So yeah, it would be very personal depending on the situation, for sure. That's great. I want to end us off there because I see that we are at 10 after. I just wanted to end with, I know that our health officer in BC has a very famous saying out here of be kind, be calm, be safe. Rencia, I wanted to just, throw that back at you in terms of the workplace, and if you have any comments before we sign off today.
I think you said it, Marina. Be calm, be kind, be safe. That is really what it comes down to.
Fantastic. Well, for all of you who hung on today through some of our audio challenges at the beginning of the session, we so appreciate your patience. Really appreciate Rencia being here for such a great presentation. I just want to remind all of you that you will receive the follow-up email today with the link to the webinar recording. That will ideally have the full recording because the sound was okay on our end, so you can catch up on anything that you missed. Please do feel free to share that link with your colleagues as well, because it is publicly available. The email will also include a survey link that you can fill out with your feedback on today's webinar, and we'll share that with Rencia as well. So if you have any comments for her, please include those. On behalf of Charity Village, again, thank you so much for joining us today. We do have another great webinar coming up next week on August 26th, all about how you can advance your nonprofit or social impact career. So you can find more information about this and all of our upcoming webinars at charityvillage.com/webinars. Thank you again for taking part in today's session. I hope all of you have a wonderful rest of your day. Bye-bye.